Hi guys, so today I wanted to talk about my laser eye surgery. So I underwent SMILE laser eye surgery to both my eyes 17 days back. SMILE is a procedure in which a small incision is made on the cornea. So cornea is the covering around the back of your eye, and this corrects the refractive error, and the incision is about 4 millimeter. So once you receive a referral from your optometrist or your GP, the ophthalmologist assesses you thoroughly. So they run a battery of tests to ensure your eyes are healthy and the refractive error is stable. He then discussed about the different options of surgeries that are available, including PRK, LASIK and SMILE. So he recommended SMILE surgery for me because one, it is painless. Second, it is of shorter duration, and third, and the most important part was because it doesn't cause dry eyes as much as LASIK does, because I already had dry eyes and he didn't want it to worsen and me to have that experience. So after that, he gave me this booklet which had all the details about the surgery, about the do's and don'ts before the surgery and after the surgery. So what they asked me to do is, prior to the surgery, is to get non-prescription sunglasses, because it is very important, because after the surgery your eyes become extremely sensitive to sun. Second is to have someone to escort you after the surgery, because your eyes become foggy and it's difficult to drive and you need someone with you. The third important thing is they asked me to come with a clean face, no makeup, no serum, no sunscreen, nothing, because that can interfere with the laser. And it's also important that you do not fly for at least 2 weeks after the surgery. So we have to ensure the exact time when we want to undergo the surgery, because that is very important as well. 2 weeks prior to the surgery, I received a 45-page booklet which had all the information and a consent form, so that I could read the whole booklet and made an informed choice. So what happened on the day of the surgery? So prior to the operation, a nurse and staff spoke to me and they explained about what are the things I shouldn't be doing after the surgery. So I cannot have head bath for 3 days. I cannot use screen on day 1. So I can listen to podcasts and reduce screen use for at least 3 days. No yoga, no Pilates, no lifting heavy weights more than 5 kilos for at least 2 weeks. No makeup for 1 week. After that, they explained about the eye drops. So this is the antibiotic eye drops, which is used to prevent infection, and this is a steroid eye drops to prevent inflammation. They also gave me these lubricants, because you tend to have dry eyes, and whenever you feel dryness or gritty or foreign body sensation, to use these drops. Along with that, they gave me 1000 milligram of paracetamol or Panadol as an analgesic prior to the surgery. After that, they explained exactly how the surgery is performed and what are the things I should follow during the surgical process. Then Dr. Lawrence, he assessed my eyes again to ensure my refractive error is stable. He tries different tricks to ensure the refractive error is stable. He then instilled numbing drops into my eyes prior to the surgery. Now, what happened on the surgical table? So the position for the surgeries, you have to lie down with your head hyperextended. They place a pillow under your knees to ensure you do not move. It's very important not to move or even not to blink, because that can affect the surgery. Prior to the surgery, he asked questions like basic identification pointers, like what's your name, what surgery you're undergoing, which eye. So probably it is for patient identification, which is very important, so that it's the right patient undergoing the surgery. Then he introduces a speculum. Speculum is an instrument which keeps your eye open, so it keeps it open so that you don't blink. And then a conical object appears from above, and you have to focus on the green flashing lights. No, not going searching for it, just focus on that, and then it sits on your eye. So there's no pain, but some kind of pressure sensation. After that, the doctor does some maneuvers, and so I couldn't feel the pain, but there was I could there was some pressure sensation, and I could feel that he was touching my eyebrows, near my nose and below my eye. So after that, he rinsed the eyes, and then he placed this plastic shields. So these plastic shields are placed on both the eyes, and they're secured with a masking tape. So after the surgery, you have to keep them for 24 hours, and after that, for a week, you have to use it every night. So because it is very important that you don't rub your eyes or scratch your eyes. And if you have stickiness around your eyes, just use clean cotton, and clean the lids with warm water. So it's very important water doesn't enter your eyes as well. So after the surgery, my eyes were very foggy. They said it would be something like you're in a shower, but I felt like it was more like I was in a sauna, and obviously I needed help. So I had to wait for about an hour after the surgery, and they themselves call a family member to take us home when it's time to leave. So after the surgery was the most boring part, because one is your eyes are foggy, you cannot read, you cannot watch anything on TV or use mobile, you can only listen to podcasts, and it's very important to rest as well. And they also ask us to use Panadol 4th RD as a top-up, so that we do not experience pain. So by the end of the day, I started noticing that my vision had improved drastically. So my far vision was much better, but the near vision was still foggy. With days, my near vision started improving, and I specifically found that my near vision was much better during the night times than during the day. Probably it's because of the sun. And on day 7, I had a checkup, and the ophthalmologist told me that my eyes are recovering well. Now, a lot of people have questions, and I too did have questions. I am not an expert in ophthalmology, but what I can answer a few questions, because I ask a lot of questions as well. So few people had some questions, and they wanted me to make a video about my experience. So the first question was, will astigmatism be corrected? Yes, doctor said that astigmatism will be corrected. The second question was, what about presbyopia? So presbyopia is something after 40 your eyes started deteriorating in a ways you have difficulty in near vision. So I did not have any presbyopic changes, but the doctor said he will do an undercorrection. So when presbyopic changes sets in, it will be helpful. They have a specific surgery for presbyopia. One of them said, I feel anxious because you will be awake. I will tell you what the doctor told me. I was anxious. He said, it's good that you're anxious. You'll focus better, and that's better for the surgery. What about the cost? The cost of my surgery, because I got it for both eyes, was $7,200. So I had to pay the initial deposit 1 month before, about $500, and the rest of the amount 1 week prior to the surgery. Was it painful? It was definitely not painful, but I could experience some discomfort. What is the difference between LASIK, PRK, and smile surgery? I think it's about the cost. So they give a list. So what I can see is LASIK and smile. The cost of both the surgeries is the same. It's $7,200, whereas PRK is $6,950. This is at Crystal Eye and Laser Center in Craigie, Perth. It might vary at different centers. The other question is whether it is covered by Medicare or private insurance. Unfortunately, it is not covered by private insurance. I had HCF, but it didn't cover, and you do not get any rebates on Medicare. So I noticed one specific thing, that I had increased hunger. So I had a question that whether the steroid which I was using had some systemic absorption. So I asked him. So he said it doesn't have a systemic absorption. Probably it could be because surgery is a stress on the body, and the cortisol is causing increased hunger in me. So I hope I could answer some of the questions which a lot of people had. I know a lot of people want to undergo laser treatment or are thinking about it. So what I would advise is to look for an ophthalmologist who is an expert in laser eye surgeries. I went to Crystal Eye Care and Laser Center in Buragun, and Dr. Lawrence is a wonderful doctor. I would highly recommend him. He's very supportive, he's very patient, and his staff are wonderful. So thank you for watching and see you in the next video.